Okay. Clerk will call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Devin Allen, Commissioner Precinct 2.
Here.
Gary Thickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4. J.D. Johnson, Commissioner Precinct 4.
We have to star 6.
Star 6, JD, if you're on the line. Constitutes a quorum.
Constitutes quorum.
We'll go ahead and maybe.
Here.
Hi, see, right there.
Here.
Right there. Good to hear from you, JD. Our invitation this morning will be delivered from Chris Ifor, from our CIO of Tarrant County. After the invocation, please remain standing for our pledge.
Okay. Clerk will call the roll.
Glenn Whitley, County.
Good morning, Judge. Good morning, Commissioners. I read us a couple of verses here from James chapter 5. Is anyone among you in trouble? Let them pray. Is anyone happy? Let them sing songs of praise. And is anyone among you sick? Let them ask for prayers. Let us pray. Our Father in heaven, I submit to you this morning that we have all three reasons named here, Father, to praise you this morning. Father, we are grateful to be here this morning because you made it possible. Lord, I want to thank you this morning because even in the depth of the oceans and in the dark times that we go through right now, you are still on the throne of grace. And for that, Father, we trust that God, even though coronavirus, COVID-19, Father, has caused trouble in our communities, in our country, in our families, imposed distancing between us, God, there is one thing that coronavirus cannot do, and that is putting in a separation between you and your people. This morning, Father, we are thankful that you are God. And Lord, I pray for wisdom for our leaders, from our president to our governor, and God, to our commissioner's court. Father, that as they make the difficult decisions, Lord, to put our country back functioning and to defeat this wicked disease, Lord, we can count on you because you are a living God. And this morning, Lord, I pray that if there may be any that are fearful, Father, that you give them courage. If there are any this morning, God, that are worried, Father, let peace be their portion. We claim that in the name of Jesus this morning, Father, as we declare this assembly whole, and we pray these things in the name of your Son, Jesus Christ. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you, Chris.
Mr. Manius?
Thank you, Your Honor. Members of the court, just several things on the agenda this morning. Under the administrator section, item A3, we are going to have two items for you for action on that particular agenda section. Those there's a court communication in your red folder, and we will discuss that whenever we get to that point. Also under purchasing, item G4, this is RFQ 2020-051. There is a revised court communication in your red folder as it relates to that. Also, we're going to do something just slightly different on the agenda today. Normally, we start with the COVID-19 aspect, but what we're going to do first, when we get to the administrator section, we're going to go ahead and do the annual independent financial audit. And we'll have Mr. Terry Kyle with Deloitte & Touche call in at that time and give his report. And then finally, Your Honor, we do have a public hearing today. Thank you.
Okay, court members, you have before you the minutes of our regular meeting of April the 21st.
Move for approval.
Second. We have a motion, a second. We'll vote. Commissioner Brooks,
Yes.
Commissioner Allen,
Yes.
Commissioner Fickus,
Yes.
Commissioner Johnson, Commissioner Johnson,
Yes.
and the judge votes yes. Motion passes unanimously. We have a proclamation that I guess I'm going to read, and it is regarding Older Adults Month, or Older Americans Month. Whereas since 1963, the month of May has been set aside to honor the contributions older Americans have made and continue to make to our great nation. And whereas this month is a salutation to the millions of older Americans who are living longer, becoming or staying healthier and strong, mentally as well as physically, and their continuing contributions to our society strengthens and success. And whereas advances in preventative medicine, health promotion, and physical fitness, implementation of evidence-based programs, housing and transportation, assisted living devices, access to information, opportunities for employment, as well as many other areas, make our seniors some of the healthiest, most educated, most active, and most independent in the world. And whereas the Area Agency on Aging of Tarrant County is acknowledging the contributions of older Americans to the security of our country, their community service and volunteer contributions, as well as their efforts to positively impact the lives of others. And whereas aging can and should be a positive step for all Americans to take, and that the impediments that may accompany the aging process should not be obstacles for a long, happy, and meaningful life. Now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim May 2020 as Older Americans Month in Tarrant County, in witness whereof we have hereunto set our hands and caused the seal of Tarrant County to be affixed this 28th day of April 2020. I'll move its approval.
Second.
We have a motion. We have a motion and a second. Please vote. Commissioner Brooks,
As an older American, I vote yes.
yeah, there's a lot of us going to be in that category. The one that's not, Commissioner Allen,
Of course, yes.
Commissioner Fickus,
As an older American, but younger than Commissioner Brooks, I vote yes.
Commissioner Johnson,
Yeah, those two don't know what old is.
I want to take that as a yes. And the judge, the youngest of the older Americans, he also votes yes. So the motion passes unanimously. Thank you all very much. Now, the next item is our consent agenda.
Move approval of the consent agenda.
Second.
We have a motion and a second to approve the consent agenda. Commissioner Brooks,
Yes.
Commissioner Allen,
Yes.
Commissioner Fickus,
Yes.
Commissioner Johnson,
Yes.
and the judge votes yes. Motion passes unanimously. Next, we have a public hearing. And Ms. Ward, come on down.
Good morning.
Good morning.
This morning, we are requesting the Commissioners Court conduct a public hearing to consider the draft 5-year 2024 consolidated plan. This plan covers the federal HUD programs, CDBG, home, and ESG. We will listen to public input this morning and come back to you and prepare to submit our annual plan, or 4-year plan and our annual plan to HUD in the coming weeks.
Thank you. At this time, I will open the public hearing and ask if there's anyone here wishing to speak to this matter. There being none, then I will close the public hearing, and then you will address this at a later point.
Yes, sir. If you have any questions, please call me. Thank you.
Commissioner Allen, I scribbled some notes on the little note that you said to me, and I believe that was your smiley face that says you have one announcement.
I do have one announcement, and really it's just to provide thanks. Yesterday evening, we hosted a teletown hall focusing on housing and rent concerns. So I wanted to thank the Precinct 2 audience and anyone else that called in and asked some really good questions just to clear up confusion about anything related to housing and rent and resources that are available. Wanted to thank Dr. Tanasia for participating, as well as Patricia Ward, Mindy Cochran, the director of Arlington Housing Department, Stuart Campbell with Northwest Legal Aid, and then Perry Pillow of the Apartment Association. So we'll be hosting a number of other teletown halls based off of needs that we get communicated to by Precinct 2 and Tarrant County residents.
Thank you.
Judge, I have
Go
one
ahead.
thing. Tomorrow evening at 6 o'clock, we're doing a Facebook Live.
Excuse me while the train runs through. There's something up, they're doing something upstairs, I guess, in the, on the roof.
On the roof?
What are we doing, Mr. Phillips?
Anyway, it's at 6 o'clock, and so I think it is at Commissioner Gary Fickus. So the Facebook address. And we have Judge Whitley will be on with us, and so will Benny. So.
And he's back there shaking his head. So I think it's a good sign. Okay, with that, we will next move to the administrator's section.
Thank you, Your Honor. And if you would call Mr. Kyle, please.
No, I know. Okay, here it is, right here. If you're watching, Terry, it's fixing to ring, I hope.
So as the judge calls Mr. Collies with Deloitte & Touche, who are outside auditors, the action that we're going
this is Barry Kyle. Leave a message. Thanks.
At the tone, please record your message. When you have finished recording, you may hang up or press 1 for...
That probably wasn't the response you were looking for.
Go ahead, Mr. Manius.
So, the first item is the annual independent financial audit for Tarrant County for the fiscal year, which ended September 30th of 2019. We have sent you all a copy of that.
This is Barry Kyle. Leave a message. Thanks.
And Mr., do you want to come back to this, Judge?
No, I'm fixing to text him and tell him to get off the damn phone.
Okay. So, state statute, the local government code requires that the Commissioners Court do an outside financial audit for any county that has a population of over 350,000. Deloitte & Touche has been doing this for several years now, and this is the annual report. We're not going to ask that you approve it. We're going to ask that you simply receive and file the document. And normally at this time, Mr. Kyle would be here, but because of we're teleconferencing, and he'll be able to go over this report with you as soon as we get him on the line.
What time do we tell him we'd call?
Hello, this is Barry Kyle. Leave a message. Thanks.
At the tone, please record your message.
Judge,
when you have finished recording, you may hang up or press 1 for more options.
So you think you're getting away from having to answer the questions this year? You're not. I will keep calling. Bye.
So let us go to another item, and then we'll come back to that. Just a couple of things on the agenda. We're going to go now to the presentation by Dr. Tanasia as it relates to the COVID-19 But when we get to item number 2, we've included in your red folder the 3 executive orders that the governor had issued yesterday. So I know that will be a discussion point as we go through the presentation. Also, if you want to have any type of conversation about the current executive order that the judge has issued, that'll be the time to discuss that also. So would you like to discuss the orders first, or would you like to get into the presentation first?
Why don't we go ahead and get into the presentation first?
Great. Mr. Spinelli.
Good morning, Your Honor, members of the court.
Good morning.
We will go through our coronavirus briefing again this morning, and I'm going to try to do things a little bit different. I'm just going to share with you Tarrant County numbers. For this time around, I'm going to skip the other updates. Reason being, I have a lot to cover related to the governor's order and the federal plan. So I want to make sure we have time to go through some of those. And if you have any questions, unless they're like really need to be answered, if we can hold them to the end. Otherwise, I will not get through this today. It's a lot to cover.
Okay, I'm gonna stop you.
Yes, sir.
So you're not already going to
yes,
get through
sir.
this. Terry Kyle wrote back and said for some reason his phone won't let him answer. Yeah, Terry, I believe that. So can we give him a number to call in on here?
We'll get a number. Plus, I believe we have an audience participation form on the annual audit also. So let us get a different number for him to call, and we'll work it out.
Do we want to do that now, or do we want to?
Why don't we go with this?
Okay.
Right, and then
That's Vinny? Okay, yeah, we'll go with this.
With the update. Yes, sir. Okay, so for Tarrant County, we're going to be declaring 71 new cases this morning, bringing our total to 2,090. And we do have 5 more deaths to report today, bringing our total to 58. If we can get a look at our coronavirus.tarrantcounty.com page, the other one, please. Okay, and if you can scroll a little bit down, I want to show something. Just a little bit more. Oh, not the full page dashboard, please, just the page. Okay, if you keep scrolling down, you see that under other information, there's a I guess a logo called COVID testing with the coronavirus logo. If we click on that, it gets us to a information page. If you could scroll down, this page is more like frequently asked questions about COVID-19 screening and testing. And the reason we put it there is now with partnership with the UNT Health Science Center, City of Fort Worth, and City of Arlington, we have a couple of testing sites available in the county. And we also put together a screening tool with a lot of our technology partners. It's Alliance for Innovation, but it includes Adobe, Oracle, Splunk, our own IT department. A bunch of people helped us put together the testing and screening tool, if you will, that makes a qualified referral to those testing sites. For now, through that tool, you get an appointment at the Fort Worth location, but we're working with Arlington to start sharing this information with them as well. So if you scroll, either you click on the logo on top, the banner, or you scroll down to the bottom of the page, you get to the COVID testing screening tool. And it's a brief questionnaire. It takes about 5 minutes to go through some history taking. You know, do you have fever? Do you have these symptoms? Are you a healthcare worker? And many of those criteria that CDC provided. And in the end, based on those criteria, it qualifies you or disqualifies you for a test at one of our locations. So far, it's been going well. I think we were originally starting with a very limited capacity and then realized it was going to run out fairly quick. So our partners added some more capacity, but in reality, I think we're going to run out today for the week. And this was a pilot week just to make sure the tool is working right and the locations are, you know, making sure their traffic flows and other arrangements are working okay.
So when you say they're going to run out, are they going to run out of the reagents to do the testing, or are they running out of the appointments that we've set up?
Appointments available that we've set up, yes, sir. And
why can't we just keep open it back up and keep setting up appointments?
Well, it's because they really do want to test out their process, make sure they have everything working correctly. They didn't want to degrade the customer experience, if you will, people coming on site and then having to wait a long time or things not be ready for them. So this week gives them that opportunity to sort of work out any kinks in their process.
So it's still them placing the limitations on how many appointments, not your ability to schedule appointments.
Correct. Yeah. So the system can schedule however many you want. It's just the sites need to be ready to take that many people and have the tests available, the staff available, and everything worked out from a flow standpoint.
Do you have to tell the program every day how many slots or how many interviews you've got, and then it fills those up?
Correct, yes. And the sites are now being trained on how to manage that on the back end for themselves, yes.
Okay.
Yes, sir. So, in short...
Judge Woodland,
Yes, sir.
I recognize that Benny asked that we hold questions and comments to the end, but I think to do that would kind of bury the lead here.
That's okay.
I'd like for Benny to go back to his Tarrant County statistics, and I've got some comments about that. Would you go back to that, Benny, please?
The dashboard, please. There we go. Yes, sir.
As of this morning, you reported, I'm trying to get to the email, you reported 71 new cases this morning, 73 new cases yesterday, 5 new deaths today. I would submit to you that this is the surge that we've both been expecting and dreading. These cases are at the Federal Medical Center. They're in our jail. They're in our nursing homes and retirement and rehab centers. All of these are places where people have limited to no choice about being there. These are places where social distancing is very difficult to achieve. They are therefore perfect incubators for the COVID-19 virus. I feel like we must allocate some resources to address this spread to these vulnerable populations and the staffs that serve them. Would you please comment on that?
Yes, sir, Commissioner. You're right on target for that. We did see an increase in facility-related reports coming in. As you're aware now, a lot of these, and I call them facilities as sort of a general term. They include long-term care facilities, retirement communities, independent living, jail settings, whether they're county or federal, other facilities. So a lot of facilities are starting to experience, outbreaks, whether it's just a couple of cases or larger numbers at some facilities. And we're working with them from an epidemiology standpoint. And some we've worked with them on testing. Some have done it on their own. And once we talk about the governor's plan today, it really calls out special attention to these long-term care type facilities and really trying to address the outbreaks there. So absolutely, we're with you on that one, and that is where the focus needs to be.
I agree with you that that's where the focus needs to be, and I recognize that epidemiology is an important step in this process, but epidemiology does not provide testing. Epidemiology is not about treatment. Epidemiology is about identifying where the infection has spread to from the original contacts. We've got to do something more directly than epidemiology to address this spread.
Yes, sir. So, like I said, in the governor's plan, there's a special call out about increasing testing capability, And they have like 8 or 9 things in there really to address infection control practices, limitation of staff floating, if you will, from facility to facility. I think that's been a problem because a lot of these folks have part-time
That is
roles.
a problem,
Yes, sir. Yes, sir. So all of those things, I think, with the governor's plan and with help from local public health, will be addressed. We're ready to, make that effort as directed by our Commissioner's Court, and we'll work with it. That's like I said, that's where we're starting to see a problem emerge, and our focus is going to be in addressing that problem.
What kind of direction would you like to see from Commissioner's Court in order to give you the tools that you need to address this situation?
So we're planning on following what's in the governor's plan on long-term care facilities. So if you have any other additional input, that's what I was looking for. If there's anything differently y'all would like to see happening in Tarrant County. Otherwise, that plan is very clearly laid out on what should happen with long-term care facilities.
Commissioner, I have talked with Representative Granger specifically about the federal prison, which is where a big part of a hot spot certainly is right now. And I think she's going to try. Remember, the federal comes under the guidance of the CDC.
Yes, sir.
And so
Yes, I'm aware of that.
And so we're hopeful that CDC will take responsibility for the federal prison. I believe that there's 2 units. There's one female unit, which is at Carswell. There's another male unit, which is out just north of our resource connection.
That's
I
correct.
believe that most of the problems, Vinny, are they occurring in the women's or in the men's?
In the men's facility, yes, sir.
Okay.
Yes, sir.
And so those are where I believe is UNT.
UNT Health Sciences is their healthcare provider for that facility, and then as a backup for hospitalization, they have JPS as their primary hospital, and a couple of other secondary like Medical City and Baylor.
But what we're trying to do in my conversations with Representative Granger was to try to get CDC to come in and do much more widespread testing over the entire unit. And there's several units within that federal prison. One unit in particular had about 240 prisoners that were tested, and of that 200 plus were positive. So around 80%.
And if I may, I don't know if people are familiar with, so let's take the federal facilities aside because there's a federal jurisdiction there. But for other facilities that are either retirement communities, long-term care facilities, nursing homes, the role that public health plays. Once we find out about a case or 2 cases at that facility, we do go out, and a couple of different things happen. The epidemiology team either goes or does a consultation on the phone about the outbreak and what's happening on the ground and gives them their guidance. But also our local health authority has been making in-person visits to these facilities to assess what their infection control practices are like, and if they need any specific guidance to tighten up those infection control practices. And if appropriate, she's given them control orders to make sure they have written guidance from her on what needs to happen. And then the epidemiology team follows up. And again, it's kind of depending on the facility. Some are doing private testing through a contractor. Some are working with us for testing. And we've done sort of a mishmash of things depending on what the scenario calls for. And so that's kind of in general what happens. But there are facilities that have had more intervention from HHSC Regulatory, which is the regulatory entity for some of these facilities that are considered long-term care under a license from HHSC. We work with them all the time to keep them informed of an outbreak at a facility, and if needed, they have either sent staff in person or consultations on the phone to give their guidance to these facilities. And then in 1 or 2 cases, we've also asked the SHS to step in with something called the ICAR request. It's an infection control assessment request that they used to do in person, but because a lot of facilities are now having these outbreaks, they've switched to an online or on telephone mode. Works just as well. But we've engaged appropriate entities on situations that warrant those. If it's a 1 or 2 cases, usually our intervention's plenty enough But if it's a larger outbreak, we've called in help from other other entities as well. So I just want to make sure y'all are aware that that's how the process goes. And if anything else is needed, we're more than happy to take that guidance and put that into action.
Vinny, I am aware of what public health's role has been in this. You and I have talked about it several times over the past couple of weeks, and I applaud you for the work that you are doing. I just want to make sure that you have all of the resources that you need to focus on these nursing homes, retirement communities, and other similar institutions, because those are under our control.
Yes, sir.
If you need anything that you do not have, let us know.
I will. Yes, sir. As the focus now shifts to these long-term care facilities, if more needs are identified, I will be more than happy to bring that through our administrator's office to Commissioner's Court, and we'll go from there.
Thank you, sir.
All right. Thank you.
So, Vinny, I know you'd really like to move on, but I have questions about this particular area.
understand.
I have other questions, which
Yes,
I will
ma'am.
wait to the end of your presentation. But a couple of things. One, regarding the federal facilities, and I understand that that's under federal agencies, but have we been able to make any traction on ensuring that the employees that work at those facilities have access to testing through the facilities? I know that there was some conversation about community-based options or them visiting their own physicians, but that may not be as accessible as we would like right now.
Right. So we did make the offer. I have to see what they found in response. I did not connect with our health authority on that particular topic, but she did make 2 visits over the weekend, I think on Saturday and Sunday, to sort of give them her guidance on what she's experienced at other facilities and how they can, do things a little bit differently at their facility to prevent the spread from continuing.
Okay.
Yes.
And then also, last week on our agenda, we approved the MOU with MedStar to talk about some of these prevention measures for these facilities. Can you speak to kind of where we are in the implementation of that?
Right. So I will connect with MedStar again. I know we told them that the MOU is signed, and the plan is to have them visit with these facilities to talk about proper PPE training, and then our epidemiology team to follow up on infection control practices. So it's kind of a concerted effort. As you may understand, a lot of these facilities have staff that come and go and they change. So it's not something new. We've done this in the past with facilities. I know I've been out there 2 or 3 years ago with my epidemiology team, giving them more like a public health handbook on what needs to happen when there's an outbreak. Usually it's norovirus outbreaks that people experience, or a flu outbreak, and to tell them on how to work through those little outbreaks and how to document everything. But as time goes by, people change, administrators change at these facilities, and staff change. So it's a kind of a revisit effort with them, but we're including MedStar so they can train them on how to wear proper PPE.
Thank you.
But I will get back to you on how far we are on that implementation.
Great.
Yes. Okay. All right. Let's get back to my slides if I can.
Remember where you were?
Yes, sir. Okay. Back to the slides, please. Okay. So we're good with the numbers, and we've talked about our testing collaboration in Tarrant County, and it's a key piece in a lot of the federal and state strategy on reopening to have robust testing capability available. So we're at the beginning of spreading that out in our community. There have been private entities that have brought some testing capability, but we're adding to that mix. And I know our judge has mentioned a couple of times that the governor has kind of tasked a National Guard task force in 25 different locations, and we're supposed to get one here in Tarrant County sometime soon. So there will be enough testing available shortly. I mean, we're still working our way through it. It's never enough, but we're getting there. The numbers are starting to show. I haven't looked at the numbers this morning, but like as of yesterday, 290-some thousand tests were administered in Texas. And that's a striking difference from just a couple weeks ago where we were in the teens, if you will. So huge increases every day in testing capability, and that's what we're seeing in our county as well. Okay, So the governor came out yesterday with the Open Texas Report, and he's asked us to set a new course, guided by data and doctors. And he's made it clear that the stay-at-home order expires April 30th, and his new plan has some key points. Even though the executive order asking people to stay at home expires, a key tenet of the new plan still is stay at home still if you can. I mean, it's not mandated after April 30th, but you are, I guess, highly encouraged that if it, is not urgent that you go out, you still try to stay at home because that's the best strategy. Then if you're going to be out, wear a mask to help save lives. It's not it's not a requirement, but it's a strong recommendation that people do that when they are out and about in the community to protect others. And then really calling out the seniors over 65 to minimize contact and try to stay at home as much as possible, even going out to call out that avoid contact with young kids, which is very hard. Seniors have grandkids, but to try to stay protected is what the report was calling out for. And then some of the key focus areas, again, like Commissioner Brooks was saying, it's long-term care facilities. Statewide, we're experiencing that as a problem where the outbreaks is starting to really emerge in these long-term care facilities. So the plan has like 8 or 9 things about long-term care facilities, but the main areas are focusing on testing and identifying and isolating individuals that have the virus, and then really strong infection control practices, including limiting staff from floating around to multiple facilities. And then for communities, there's robust testing capabilities guidelines, statewide rollout of the National Guard supported sites, local government supported sites like we've seen here in Tarrant County, and the private sector capacity coming online is a key tenet of that robust testing capabilities. And then the state is rolling out a statewide contact tracing program. They've done a couple of things. I believe they have procured an application that allows for contact tracing, and they're leveraging a statewide workforce. I believe in their phase 1, they have identified 1,100 or so workers that are trained on contact tracing, and phase 2 calls for about 4,000 contact tracers to be part of that team. We, as local public health, have calls set up with DSHS, I believe, towards the end of this week to get more details. And there's a quick survey they sent out this morning to find out where we are in our capabilities for contact tracing. So it's a sort of a work in progress, but the phase 1 was to identify and have these things, procured, and I believe they've done that. And now it's the rollout phase for phase 2 for contact tracing. So the Texas plan relies on a boxing in strategy, as the governor was outlining yesterday. The goal is to test widely and isolate infected individuals, find and contact trace people around them, and quarantine those exposed contacts for 14 days. All of the process that we've talked about and done here, but now they're really laying it out in a sort of a key strategy of boxing in COVID-19 and trying to sort of stamp it out in where there's outbreaks occurring. So this kind of aligns well with the federal plan on opening up America again. A lot of the state strategy, if you look at the details, falls under that center box of preparedness of what states should do to meet the challenges needed. And both plans call out for a very phased approach, the federal plan and the state plan. And for today's presentation, I don't have that phased approach outlined because it's going to get too long. It's about, how to open businesses and what's appropriate for individuals and so forth. So I'm going to focus in on the areas that fall on public health to continue to work on. So federal plan also outlined some, I forgot to talk about the details of the state plan, but as you can see, they also have some gating criteria for public health to be looking at to work with decision makers on whether our community is showing data that is ready for these actions to be taking place. Now, the governor has looked at statewide data, and that's where his plan is kind of based on. But I'm going to show you today what our data shows for Tarrant County. And the federal plan had these gating criteria based on symptoms, cases, and hospitals. And then if you look at those state responsibilities, like I was saying, it really focuses in on what our plan is for Texas. It really aligns well with this federal plan. And then the phased approach really, again, goes in about mitigating resurgence of the disease and really watching for that to occur. If we start to ease up on some of these restrictions, then looking at data and taking action again to tighten up if a resurgence occurs and to protect the vulnerable. And that's really the main tenet of the proposed phased approach in both plans. So from a data standpoint for Tarrant County, the federal plan calls for looking at syndromic surveillance indicators in their symptom part. And they called out for influenza-like illness and then COVID-like illness. So influenza-like illness is our dark green line for this season, and it's going down as seasonally expected, but there is a little bit of a caveat there. If you see, we had a spike up in March, and then as of March 13th, it suddenly started declining very sharply. Now, that could be an impact because there were executive orders out. Only if you're seriously ill, go to the emergency room or to the doctor. If you're mildly ill, stay home. Now, does it align well with what seasonally occurs with influenza? Yes. But can that have a little bit of an impact of when we told people not to go if they're mildly ill? Yes. So, even though we're on a decline, we have to kind of think about that for a second. But seasonally, I can say we are in good shape from influenza actually coming down. So that indicator's been met. What has not been met is COVID-like illness. It's trending up in our community. Not crazy wild trending up, but it's up for the last 10 days or so. We're at about 2% of ED visits with COVID-like illness. Case trend. So just the number of lab confirmed cases. It's kind of flat. Reporting has been more, but if you look at when the onset of illness was or when the specimen was collected, it's kind of flat. I mean, for the last maybe week, we had a little bit of an uptick. If you look at the zoomed in right chart on the case trend, you see that uptick starting to occur. And for that zoomed in chart, we took out the most recent incubation period so you could see more confirmed data. Because if you want to look on the left chart, there's a note that most recent data may not yet be reported. And the average lag is about 9 or 10 days from specimen being collected to it getting into public health and everything kind of starting to work on. So we're taking out a full incubation period just to make sure we're looking at accurate information. But overall, it seems like we've got a flat trend. It's not a declining trend, and it's not going up very wildly either, but it is a flat, like we talked about, the flattening of the epidemic curve. Testing data. So it's kind of gone up and down a little, but over the last 7 days or so, and then looking at the last 2 weeks, we can say the 7-day moving average on the right, if you see the dotted line, is actually declining on the positivity of the test. So we're starting to dip close to and below the 10% mark, and there have been times where we've been up almost close to 15% on positivity and have come back down to the 10% and started to dip below that. So average lag is about 3 days on that data. So we're in good shape that is starting to decline on a testing basis. Hospital trends. So the federal plan called for something else on hospital. It's like whether the hospitals can see all the patients without critical care. And we're still trying to determine that from our hospital partners. And then they called for robust testing for healthcare workers, including new testing like antibody testing and so forth being looked at. We don't have all of that available to us. Testing, whether it's robust or it's in the early phases, I mean, that's sort of debatable. But what we do have is hospital trends of patients with COVID-19 in the hospital. It is up for the last 2 weeks or so. We, I think, saw a low on April 11th with about 113 confirmed cases in our Tarrant County hospitals. And as of this morning, we'll report the data today at about midday, we have about 188. So I think we were hanging around at about 4% of occupancy of all the beds that are occupied by COVID-19, and now we've ticked up to about 5%. I don't know that it's a major change, but it's still a change in the wrong direction, that we're going up instead of going down. So that's what our data shows. And the key takeaway messages are, the governor's order was very clear that his order supersedes, and here's what the reopening plan for Texas is. So if we follow that, there has to be a very, very cautious approach to reopening. Smart business decisions need to be made. Smart individual decisions need to be made, because our data is showing that we may not be yet ready to do all of that. But if that's what the plan is, then we're going to have to be very smart about it. And what we need to do as a community, everyone should be urged to wear a mask. It's not a mandate, but really, let's be very, very careful. You know, we should all be wearing a mask when we're outside in the public and where social distancing is not possible. Yes, sir.
One question. You said 188 folks in the hospitals.
Yes, sir.
What's the total available beds?
Can we get back to the dashboard?
So total bed capacity.
Hospital capacity, please.
Right there. So we had 2,707 available beds. So if we're looking at, I think the governor's order required hospitals to hold on to 15% of their bed capacity. So 15% of that would be about 760. And we've got 188 people in the deal. So we're still well below.
Yes, sir.
Well below the request by the governor as far as available beds specifically set aside for COVID-19
Correct.
patients.
Yes, sir. So I believe if you look at the hospital capacity chart, we have 47% of available beds out of all the beds that we have in Tarrant County. So we're way above what the governor was recommending from that standpoint. He's asking for 15% of capacity to be for COVID-19. So that alone is good enough in those numbers. And what I was pointing out is that occupied beds, there is about now 6% instead of 4% that we had seen kind of as an average for several weeks. We've ticked up a little on that number. So the trend is up, but are we good in good shape from a hospital capacity standpoint? Yes, we are. Yes,
Again, that was the focus of us putting the restrictions in place in the first place.
Yes, sir.
Was to make sure that our hospitals stayed open and available for the folks with the emergencies other than COVID-19, you know, appendectomies, the heart attacks, the accidents, whatever it may be. We wanted to be sure the hospitals were open, and we've been very successful in making sure that that was the case throughout this process.
Yes, sir. Yes, sir. That's one of the key indicators for severity of the illness. So you have to look at the syndromic side that kind of gives you like a quick temp gauge of your community, what's happening. Then you get the confirmed cases that's showing you confirmed data, right? Syndromic is more, let's just get a quick take on what's happening in the community, take a temp. And then confirmed cases give you more granular data, testing gives you more granular data, and then the hospitalization data gives you severity of illness in your community. What's happening? Is it mild? Is it really causing a lot of problems? So those all work together in the same picture. Yes, sir.
Thank you.
Okay, back to my slide. And I believe that's almost the last slide I think we're breezing through. All right. And then, so the recommendations need to be that everyone should wear a mask and practice social distancing as much as we can. And then if the stay-at-home order is being lifted up, stay at home as much as possible. And the governor made it very clear that it's not a mandate for you to go out and start doing things. It is the ability for you to do what you think is right for your family and your neighbors and your friends. And if you need to go to work or if you need to go somewhere, there's no restriction on that at that point, but still highly encouraged to stay at home and distance from others as possible. And again, we are a community. We work together. Without each other's help, it's not possible. I know our business community has been working hard in making this possible, and our leadership has been working hard. And I want to thank our citizens, our county residents. They have made this possible. The curve is truly flattening out, as you can see in our data. Even though the reports are more, that if you look at when the date of onset was and the date of specimen collection was, that curve is truly flattened out. Now, is it going down? Maybe not yet, but it is flattening of the curve. We've achieved that. And with that, I'll open for any further questions.
Just a comment, please, Judge.
You bet.
I want to compliment the Public Health Department in general and Benny in particular for his leadership on this pandemic. I think that y'all have done an excellent job with the hand that you've been dealt. You provide us with excellent information. I appreciate the governor's order. I think he's done a good job of tap dancing on the head of a pin. But there's a lot in that order that speaks to where we are, especially if you take the Tarrant County statistics into consideration. The Tarrant County statistics tell me that it is not yet time to ease up on our stay-at-home order. It is a matter now of individual choice. And as for me and my house, we intend to stay at home. And I hope that the rest of the community will make the same choice. Thank you, Benny, for your leadership.
Thank you, sir. And as always, I want to make sure I recognize my team and a lot of our other departments in the county that have really, really helped us through this effort. This is a marathon, and, we're going to have more work coming to us. So I appreciate all the support that our team has, the effort they've made, and all the county departments that have supported us.
Okay,
I've got questions. So if we could go to the self-screening and testing appointments. Well, first, is there a way that we can make the button that leads people to the testing and the frequently asked questions and all of that more prominent? It's a little buried right now.
Okay, yes, we can.
Okay.
We will call that out.
Okay. And then I just want to make sure that I understand. So if I live on the east side of the county and I go to this form and I'm able to, I go through the process, I get an appointment, I'm having to come to Fort Worth currently because Arlington's test site is not aligned with this form.
That is correct.
When
yes.
do we expect for that to happen?
So we've been working with them. Our goal is to have them on board probably by the end of this week or early next week.
Okay.
Yes.
Okay. Let's see. So the slide about the Open Texas report, I don't have it numbered here, so I'm not sure. But it addresses the statewide tracing program.
Yes, ma'am.
What does that mean for us? I mean, I know that we've been doing that, but if there's a statewide program, is that helping us, or is it making a difference necessarily?
So I think what they're looking at is really aligning with what the federal strategy has been around that we need to test, isolate, and contact trace anybody that, tests positive for the illness. So to do that, really no local health department has that much capacity. So the state is standing up a couple of different things. One is that I believe they've procured an app through a company that has made it easy. We are yet to see that because this is just kind of happening as we speak. And the second piece is that they've identified a trained workforce of about 1,100. I mean, I'm kind of quoting off of the governor's phase 1 plan off of there. And then their plan is to increase that to about 4,000. Remains to be seen, and discussions are going to be had with the SHS on how we can plug and play with that. We take all the help we can get. I mean, if we can offload some of this contact tracing piece to the SHS folks or the staff that they're bringing on and the app, maybe we can focus in a little bit more on the long-term care facility and do that work, because that's where the burden is right now in our community in the outbreak. So more to come on this. I think there's a call scheduled for Thursday that we're going to find out some more. And like I said, there's a survey out from DSHS this morning asking on what our questions may be. I think they're preparing for the call.
And again, one of the things that we might do there, I know we have a number of volunteers from the Health Science Center. If we can continue to utilize the fire department employees in Arlington to begin the answering of the survey questions, and then that may free up some folks on the back end that could be doing this contract testing. The other thing we probably need to re-emphasize to everyone is to keep a little bit of a journal as to who you've been around each day, so that if you do come down with the virus, that we've got, immediately they can just hand this over and say, here are the folks I've been around for the last 3 or 4 days.
Yes, sir. That's a very good strategy. I think people should do that anyways. Just a quick jot down of where they've been and who all they have been in touch with. If you make a habit, a lot of people use smartphones these days. You can just note that down in your phone. You don't even have to have a journal with you. And if anybody uses calendars for various appointments, and people do for even personal stuff, those come in real handy as well.
Put on about 2 hands how many people I've been around in the last 2 weeks.
Yes, sir. Any other questions?
Yeah, I have one more question for you. Give me 1 second.
Yes,
I
ma'am.
thought I had it pulled up. Let's see.
You say the survey is taking about 5 minutes to do?
Well, it again depends on how well you type, but yes, average is about 5 minutes. It's not a whole lot of questions to screen. It goes over some of the basic symptoms like CDC put out. It asks about your occupation. Are you a healthcare worker or a critical function worker? And then it goes over the symptoms like, do you have fever? Have you had chills, headache, all those type of things? And then based on all of that, really the algorithm's running to put you in risk categories that CDC helped us define based on their recommendations. And it's high, medium, and low. And right now, because we're in the early phases, and again, people have heard me say testing capability is limited. So high-risk folks are being qualified for testing, meaning their symptoms match up or they have a high-risk occupation. But then as testing becomes more widespread, we have the flexibility now to add medium-risk folks in there. And if it really becomes easily available, technically you could offer the test to everybody. I don't know that we're going to get there anytime soon, so I don't want people to hang on to that idea. But, yes, through the system, all is possible. It's, the matching up of real capabilities from testing sites versus what the system can do. The system can be programmed to do whatever, but the real capabilities and availability of testing is the issue.
Great. So 2 questions. One is, and this came in from a constituent of mine, I'm going to read the statement and then a question, which I think you've partially answered, but I want to make sure we're not missing anything here. Hospitals in every state are scrambling to determine containment protocols, and some emergency rooms are either banning the admission of certain vulnerable populations or treating older adults diagnosed with COVID and then releasing them back to care facilities that have little to no ability or equipment to implement containment protocols. How is this being addressed in Texas and Tarrant?
Right. So that is one of the things, and I'm trying to think, it's part of the federal plan about whether you're treating patients under a critical care mode or in your regular ops. In your regular operation, this doesn't happen. You go to the hospital, they take care of you, send you home if you're well. I think they've made some shifts to open up bed capacity and limit access into healthcare because, they were trying to save the system for critically ill. So that's one piece that's yet to be determined. And I do understand that there was another robust piece about having PPE available where the local entities and the states are not calling out for help, that it's widely available. And a lot of that goes into this decision making. Do they have enough PPE at their hospital facility and even at the long-term care facility where they might be released back to so proper care can be taken? So those are some pending answers. Like I said, our data is not aligning exactly how we would like for it to be, but the plan is the plan, and if that's our plan, then we need to be extra cautious on how we reopen and be very mindful that if things don't stay flat, then we come back and go back to a tightening phase. That's without a tool like a vaccine or an antiviral cure. This is really the tool that we have: wear a mask and social distance, and that needs to be very, very clear when we get on this path.
Thank you. So my last question is about the data. And for these days where we've seen an increased number of cases, have we yet been able to figure out what percentage of those new cases are from facilities and the issues there versus individuals who have confirmed positive?
Yes. So last week we had almost 700 cases reported, a little bit over 700. And when they got redistributed by date of specimen, the curve is still flat. So I want you to understand that this was not a unusual spike that we just saw last week. It was a lot of data lag being cleaned up by a variety of systems. And we did find, though, that there were about 20% or so facility outbreaks that contributed to that increase as well. You've heard some of that from me, that there's been multiple facilities that are experiencing outbreaks, and those numbers are being added as we go along every day. Overall, and again, I don't have the exact numbers with me, but we are starting to see an increase in facility-related outbreaks and cases coming from those. Because again, like Commissioner Brooks was saying, these are congregate settings, and they're kind of an incubation setting, right? I mean, it's very hard to socially distance a lot of people that are in a tight setting. And perfect example is the jail setting. I mean, they're in bays, in cells. There's not much you can do once you have a case in there, it spreads. You can isolate them. You can treat that whole bay under a quarantine. There is no treatment, cure, things like that. Now, if they're seriously ill, they're hospitalized. That's part of the reason our hospital numbers are up. As you're aware, we had increased uptake in hospitalizations because of ill inmates in the hospital. So, that's unfortunate, but that's the reality.
Thank you.
Okay, thank you.
I have a lot of audience participations, and they're all talking about impact to Tarrant County of the COVID-19. I'm not sure we should just go ahead and call them all in right now. Do you have more? Good. So at this point in time, I think we'll just start the parade, and the first person who I'm going to call is going to be Brody Mulligan. Or at least I hope I'm going to call him. There's no telephone number. Wait a minute. It's got a whole bunch. You got them? No. Excuse me. The first one I'm going to call is Tara Wilson.
This is Tara.
Tara, this is Judge Whitley. You had submitted a request to speak, and we're on that item on the agenda. So at this time, I would ask that you give us your name and address, and then you have 3 minutes to make any comments you'd like to make.
Okay, great. Thank you. Thank you, Judge Whitley and Commissioner Court. My name is Tara Wilson. I live in Fort Worth and live in zip code 76112. And I'm calling in today to piggyback just on the end of that conversation that was being had by Vinny in regards to incubation settings and the spread of COVID-19. There's been a lot of discussion about mitigating the spread, but how we have vulnerable populations within Tarrant County that do not have the luxury of social distancing. And one of our most vulnerable entities is the Tarrant County Jail. There has been a lot of discussion as to what the Sheriff Rayburn has been doing in mitigating, spread at the jail. It has been asked of this court and other officials and how to reduce the jail population in order to help mitigate the spread of COVID-19. We've asked that low-level nonviolent offenders try to be released, if possible, on PR bonds. And I know that from the data that's shown, there has not really been a true reduction in the jail census. So my background is I am a nurse, and I at one time did work in a county jail facility, so I'm kind of aware of some of the practices that go on behind the doors. And so I'm calling in today from that perspective and just kind of asking the questions of the sheriff's department, and maybe questions that other people should be posing. And, what are the protocols that are in place to keep these vulnerable individuals from contracting it? There's a revolving door in the jail from vendors who have to come in and provide specific needs and supplies to the jail, from medical staff and jailers that go in and out to the jail and then back out to their communities and to their homes. And so I'm wondering, I know that probably staff have PPE supply or mask supply, and I'm wondering if in the jail itself are actually jailed individuals getting masks to help mitigate the spread. And then as far as the medical is concerned, as far as when inmates turn in their sick call, are they implementing new procedure to get the sick call turnaround time down, especially on inmates who present with upper respiratory infections that we know are kind of standard, that have been symptoms such as cough, shortness of breath, or fever? Are they actually working on trying to figure out, when getting these inmates screened to see, and then what protocols are in place to have continual screening or monitoring of inmates who are sick or possibly sick? Because we know that once someone has symptoms, they have already been asymptomatic for about 7 days is the running average or so.
Terry, your time is up, so if you could kind of begin wrapping up.
Yes, and so my wrap up is just that I'm asking the Commissioner's Court to be asking these questions, because even though these people are on quote unquote in jail, it is a public health risk. Because as the jail has a revolving door, not only from staff, but also from people who do go in and are released on a daily basis, that do come out into our communities and that have been in a high-risk population coming back out into the community.
Okay, Tara, there's no one here from the Sheriff's Office at this point in time, but I would say just a couple of things. One, I know that the jail population has been reduced by over 700 to 800 prisoners since this began. I know that as people have come in, I know that jailers, the folks who are coming in now, are wearing masks. I would also say that JPS has a medical unit over there that they are, taking folks to, and if as new folks come into the jail, they are being quarantined for at least a 14-day period before they're added into jail pop. And I will try next week at least to be sure that maybe we have someone here from the Sheriff's Department who could respond to to the questions that you had, or someone may have next week. Tara, thank you very much for your questions. Next is Brody Mulligan.
Sorry, I'm currently unavailable at the moment.
Okay, next is Marilyn Davis. Marilyn, this is Judge Whitley, and you had submitted a request to speak today on our agenda. We're at that point. If you will please state your name and address, and then we have allotted 3 minutes for you to make any comments that you'd like to make. So please begin.
All right, my name is Marilyn Davis. I am from Fort Worth, Texas, zip code 76119. And I just have like a few questions I really wanted to ask about. One of which is, how exactly did we even get to the point where this is a scene where we are.
I did not hear you. I couldn't understand your question. Could you repeat it?
I'm sorry. Can you hear me now? Hello?
Marilyn, you are breaking up. I don't know if you're on a speaker or what, but if you could try again. I'm not understanding your question.
Okay. Can you understand me now?
Yes.
Okay. So my main question is, how exactly did we get to a point where we are, where it seems like we're basically blindsided by the fact that we don't have the amount of, like, we're not able to do mass testing, like, as much as we very much could have been? And why not do mass testing for our most vulnerable populations? And I'm speaking, like, definitely in regards to our jailers population, as well as our elderly populations as well, the ones that are most at risk.
Marilyn, the reason we've not done mass testing is because we have not had the reagent necessary to actually run or complete those tests. It is beginning to be produced at a larger production basis by the various labs. In earlier weeks, the government, the federal government, basically requisitioned those reagents and had those distributed to hotspots around the country, primarily New York, California, and Washington. As those are beginning to free up, we are increasing our testing, but that's the reason we've not had significant number of tests being run prior to this.
Okay. And another question I did have is about what exactly is our plans for to prepare for possibly next wave of pandemic, or even the next major pandemic that comes out? Like, what is, like,
well, I think
do we have to plan for that, or
I would say that just as with this particular one, what we'll try to do, and you know, hindsight is 20/20, so we'll try to have maybe larger stocks of the protective equipment. But again, without the reagents, we can't run the tests. Those reagents we get from the labs, and those are things that that to a great extent are controlled by the federal government and CDC. And so that's where I'm sure we'll be talking with them about what could we have done differently in the future. Now your 3 minutes are up, so again, thank you very much for your questions.
Okay.
And we appreciate you calling in.
Thank you.
Next is Pamela. Nope, because I don't have a telephone number for Pamela. Natalie, I need to get a telephone number for Pamela. I want to try Brody again.
Sorry, I'm currently unavailable at the moment.
Okay, we'll try Brody if he calls in next week. Next is Cynthia. Hello, Cynthia?
Hello?
Yes, Cynthia, This is Judge Whitley, and you had put in a request to speak at our court meeting this morning. We're now to that point on the agenda. So I would ask that you repeat your name and your address, and then you have 3 minutes for any comments that you have.
Yes, sir. Thank you. First and foremost, my name is Cynthia Mancha. I am at zip code 76040 in Euless, Texas. first and foremost, I want to, commemorate and give, thanks to, all the, forefront frontliners, and first responders who are, addressing these key issues that we have in Tarrant County. My main concern right now is the opening of the cities and the establishments, within the cities, because, as public knowledge, we do understand that, a healthy person wearing a mask does little, to contract the or to reduce the transmission rate of the disease from an unhealthy person to a healthy person. But we also know that with an unhealthy person wearing a mask, coupled with a healthy person wearing a mask, that it actually decreases the transmission rate dramatically. So why are we opening up establishments or even easing up on the restrictions without a mandate in place that everybody wear a face mask? And that is also in the jailhouses. I mean, we have, people bunked on top of each other. And I understand staffers are wearing masks when they come in, or outsiders are wearing masks when they come in, but why not have the inmates who are in there, healthy or not, have masks also? On both sides, I mean, that could dramatically make a difference in our numbers if implemented correctly. And are we doing anything to try to combat that issue, by looking at protocol, looking at mandates or protocols like that?
What I would say to that, Cynthia, is again, the order that came from the governor yesterday was very specific that he would not mandate the wearing of masks and that no one could mandate that. He also indicated that, he's the one that has put the open for business order out there and has specified that we could not institute orders that would further restrict the opening of cities and the opening of businesses. So to that end, that's kind of where we are at this point in time, and that's
So
really.
You're saying, I'm sorry.
No, go ahead.
So you're saying on a city level, on a citywide level, we are not able to put a mandate that the people within the city wear a mask when they go out.
That is exactly correct, and he was very specific about that no one could override or require anyone to wear a mask.
Well, it just seems like we're dropping the ball there. It just kind of seems that we could be doing more to protect the citizens, whether they are in the jail or out, from public transmission, especially when we're just at a flat, we're not at a decline. And I don't know what can be done, or what if anything can be done, about that on the city level. But I mean, apparently not. But I guess,
yes,
but thank you. I do appreciate it.
Thank you, Cynthia. Have a good day.
All right.
Next, I'm going to call Pamela Young.
Hello.
Hi, Pamela. This is Judge Whitley, and you had requested an opportunity to speak to our court meeting today. At this time,
Yes.
what I will do is I'd ask that you repeat your name and your address, and then you have 3 minutes for comments.
Sure. My name is Pamela Young. I live in Fort Worth, Texas, 76111. I understand that Tarrant County has received or will soon be receiving millions of dollars in CARES Act funds to support coronavirus-related relief efforts. I'm asking that a portion of the grant be dedicated to mitigating the spread of COVID-19 in the Tarrant County Jail. As Dr. Taneja has stated today, the jail, including all 4 facilities, is a confined space where social distancing and acute detail to personal hygiene is not possible at the current population of roughly 3,400 people. That's down from 4,100 on May 1st. Mind you, the total capacity of the jail is around 4,700. This is a 16% decrease, and it is nowhere near enough to afford incarcerated people the opportunity to properly social distance. These conditions are showing up in the number of new positive cases in the jail. Last time we met at Commissioner's Court, there were 8 positive cases. Today, just a week later, that number has multiplied over 5 times. We have 47 positive cases and counting. And due to the revolving door nature of the jail, through staff coming and going and detainees coming and going, the jail has essentially become ground zero for growing infection and spreading the virus back into the community and overwhelming medical care capacity, again, as the doctor has stated today. That said, CARES Act and any other available funds must be allocated to stave off coronavirus spread in the Tarrant County Jail through the following measures. Number 1, the sheriff continues to state that everyone entering the jail must wear a mask. That's not good enough, as you've heard over and over and again today. As Dr. Taneja has stated, wearing a mask in public, especially where social distancing is not possible, literally helps save lives. I'm demanding that every incarcerated person be issued a fresh mask daily. Anything else is inhumane. Number 2, allocate emergency funding to the Tarrant County court-appointed attorneys to expedite getting people out of custody, and in doing so, urge felony and misdemeanor court judges and the district attorney to prioritize compassionate release through personal recognizance bonds, not plea bargains.
You have about a half a minute left, Pamela.
Asking incarcerated people who have not been convicted of a crime to plead guilty in order to go home during the pandemic is coercive and unethical. I have a quote here from an attorney, a defense attorney in Tarrant County. There is absolutely a problem, and I think it is a gross misstatement by the sheriff that the DA and the judges and the sheriff are working together to feverishly help people get out. This attorney says, I am fighting to get clients released and have not seen much effort beyond getting people to plead to convictions so that they can get out of jail. This is unacceptable. And as a tax-paying resident of Tarrant County, I won't stand for it. Number 3, allocate emergency funding to provide immediate health services to people who are being released. Number 4, ensure the safety of people who must remain incarcerated by decreasing the population by at least 50% to allow for proper social distancing and provide mass testing starting in the jail population.
Pamela, you need to begin wrapping it up.
I wrap it up by just presenting a question to the commissioners. Will you agree to provide daily masks to ensure that daily masks are provided to every incarcerated person? And will you allocate funding for indigent defense and urge all criminal justice actors in Tarrant County to prioritize compassionate release through personal recognizance bonds over plea bargains?
I don't know that, well, thank you for your comments, and we'll talk about that in a few moments. Goodbye.
Thank you.
Next is, we're going to try Brody one more time, and then we'll go from there.
This is Brody Mulligan.
Brody, this is Judge Whitley. You had requested time to speak to the court. I need you to repeat your name and address, and then you have 3 minutes for comments.
Thank you, Judge, Your Honor. My name is Brody Andrew Mulligan. My address is 312 Rambling Court in Euless, Texas, zip code 76039. Again, I thank you for the opportunity to speak with the court today. As of last Thursday, John Peter Smith Hospital officials stated that 1/3 of all coronavirus COVID-19 patients are being treated of those who are inmates. In light of these events, As a volunteer for the Tarrant County Medical Reserve Corps who has served not only currently, but additionally during the H1N1 pandemic flu response, in the interest of assisting our volunteers who support our allied health professionals, and as our public health director had mentioned earlier, upon whom we all rely, particularly with the needs for contact tracing, I echo the sentiment of others in which we have a severe issue in terms of a crisis that is developing, particularly in the Federal Bureau of Prison Systems and Facilities. Upon each of these independent prison facilities and detainment centers, they all interact and rely on our main public health system. In the interest of promoting the public health, I would ask on behalf of volunteers and citizens that to take a preemptive approach, we provide and mandate advanced protection and personal protection guidelines, as well as making sure that we are doing everything possible within the law, and if not so, finding an avenue that the court can exercise to eliminate those who are in the prison population or pre-trial detainees, and then looking to the future to ensure that we can also make every avenue available to reduce the possible spread and resurgence coming up. And I would ask that the court and the commissioners look at policies and promotion of ideas and avenues which can reduce those things, such as one of the great aspects, increasing the pretrial detainee release program, expanding access to that, as well as reforming some of the bail procedures from the county. In addition to that, looking at very seriously the impact that the 287G resolution and cooperation has with regard to the need that we will have as a county fiscally moving forward to be able to serve the community, as well as make the difficult financial choices that are going to face the county coming forward due to the economic strain from COVID-19 coronavirus. I appreciate all of the hard work that the county is doing, and I know that I echo the sentiments of my colleagues and community when I say that we are grateful for all the work that you're doing.
Thank you very much, Brody. We appreciate your comments.
Thank you.
Next is Jonathan Guardian.
This is Jonathan Guardian.
Jonathan, this is Judge Whitley. You had requested an opportunity to make comments to our court. We're at that point on the agenda. Please repeat your name and your address, and then you have 3 minutes for any comments.
Yes, sir. My name is Jonathan Guardian. I live at 3325 Martin Street, Fort Worth, Texas, 76119. Today, I wish to speak in regards to COVID-19, and I wish to speak on behalf of the coalition I Set Up Tarrant. On April 19, 2020, the coalition I Set Up Tarrant engaged in a public demonstration outside of Prairieland Detention Center in Alvarado and the Tarrant County Jail building in downtown Fort Worth. The coalition demands the immediate release of all detained people to prevent the spread of COVID-19 within these detainment centers. As of April 20, 2020, there are now 27 confirmed cases of COVID-19 within Prairieland Detention Center. This will inevitably increase the risk of exposure to COVID-19 as detainees at Prairieland live in close quarters and cannot adhere to CDC social distancing mandate. These confirmed cases can very well spread to ISA officers who work at the detention center, who in turn can further spread the disease once they leave the center. As of April 20th, 2020, there are now 8 confirmed cases of COVID-19 within the Tarrant County inmate population. 1 inmate has a pending test result. There is 1 confirmed COVID-19 positive case among jailers and 11 pending test results among the total jailers. As of April 23rd, just 3 days later, there are now 34 inmates with active positive case results in the jail, with 8 inmates pending test results and 4 jailers with active positive cases and 49 jailers with pending test results. The people detained within Tarrant County Jail live in close quarters and cannot adhere to CDC social distancing mandate. Furthermore, these confirmed cases can very well spread to ICE officers who work at a detention center, who in turn can further spread the disease once they leave the center. Neither Pearland Detention Center Director Miguel Vergara nor Tarrant County Sheriff Bill Wayborn have adopted any provisions to help curb the spread of COVID-19 within the detainment centers that they are in charge of. Their lack of action and responsibility will never lead to further community spread. Instead, Wayborn plans to continue business as usual.
One
These
minute,
unprecedented times require public health center and human policies. The coalition ICE Out of Tarrant calls upon Tarrant County Public Health Director Dr. Vinny Taneja to demand that Pearland Detention Center Director Miguel Vergara and Tarrant County Sheriff Bill Wayborn immediately release all people currently detained in their facilities and enact provisional measures to provide shelter for those detainees who are released until the government can provide further instructions on how our communities are to handle the spread of COVID-19. We hope that Tarrant County Public Health Director Department will continue this conversation with us. Please reach out to us via email at iceoutoftarrantcounty@gmail.com. We are still waiting on a response from Dr. Taneja, and so are all the sick people in Tarrant County Sheriff's Office Jail and Pearland Detention Center. Thank you.
Thank you, Jonathan. Have a nice day.
You too. Bye-bye.
Goodbye. Next will be Emma Jones. Emma, this is Judge Whitley, and you had requested an opportunity to speak to the Commissioner's Court today. We're at that part on the agenda. I would ask you to repeat your name, address, and then you have 3 minutes for any comments.
Yes, sir. Thank you so much. My name is Emma Jones, and I'm a resident of Fort Worth. I just want to take a moment to say I appreciate the efforts to increase testing availability by Dr. Taneja, and I applaud everyone's efforts today to address the public health concerns within our jail and our prison populations. I do want to take a moment to share a piece of our history and follow that up with a question for Dr. Taneja. The outbreak of mumps, scabies, and other highly contagious diseases have been documented to spread aggressively in detainment facilities. In October 2018, the Texas Department of State and Health Services reported 5 confirmed cases of mumps among immigrants transferred between 2 ICE detention centers. By August 2019, there were 898 reports of mumps cases in 57 facilities. According to the CDC report, 84% of patients were exposed while in custody. The rapid spread mumps foretells what could happen when people inside ICE custody are exposed to COVID-19. And ICE has repeatedly shown to be incapable of inadequately responding to outbreaks of contagious diseases and providing the proper care for people in custody. Are the Tarrant County local health departments conducting on-site inspections of the jail and ICE detainment centers?
Say that again.
Sure. Is Tarrant County local health departments, this would be a question for Dr. Taneja, conducting on-site inspections in jails and ICE detainment centers?
Vinny?
So I would check on the ICE detention center, but I know that we've been on site at the Tarrant County Jail several times, working with the jail staff and also JPS staff who provide jail health services. So we're working with both parties to
and I
provide.
believe Dr. Colquitt has also been at the federal prison. So we've not been at the ICE facility, but we have been at the federal prisons as well as the Tarrant County Jail.
That is correct. Yes, sir.
You have about 30 seconds left.
Sure. Is that data accessible to anyone? As a public member of the community, am I able to access that data of
I don't know that they
the number of
actually.
people in?
I don't know that they actually accumulated any data, and as far as facilities or public information regarding the individuals in there, I believe that that the individuals in at least the Tarrant County Jail may be on our website. I know at least at one point in time it was.
Yeah, so Dr. Taneja mentioned that the collection of data regarding COVID-19 will be a part of the public health response.
No, I don't think he
data
said.
collection.
I don't believe he said that the data would be available. That's HIPAA protected.
Right. But my question is for ICE detainees in high-risk categories, even those with confirmed cases, mortality, or if there's any plans in prevention within those facilities.
The ICE would have to be something at a federal level from that standpoint, and much of the data regarding health is going to be HIPAA protected. Your time is up. I'm sorry, Emma.
Thank you so much. I really appreciate your time.
You bet. Thank you. Have a good day. Next is Takesha Wade.
This is Kay.
Okay, this is Judge Whitley. You had requested the opportunity to speak at court today. We're at that point on the agenda, and I would ask you to repeat your name and address, and then you have 3 minutes to make any comments you wish to make.
Okay, hello, good morning. My name is Kay Wade. I live in zip code 76016. First of all, I would like to thank you guys' time, the Commissioner's Court time this morning. I would like to address Mrs. Allen. I am a resident, taxpayer, business owner, and cosmetologist in your precinct. I read that you believe success is attainable if one is willing to work diligently to achieve it, and that's what I'm trying to do. I am owner of Lady Heroine Glam Boutique, located inside Sola Salon Studios. I'm not sure if you're familiar with Studio Salon. There's about 45 individual mini salons in my building. Everything I need to run my essential beauty business is right in my room. Since March 22nd at 6 p.m., the government has deemed my business as non-essential, and I have been out of work. I do not have PTO or the benefit of even working from home. My career is essential to me and my family. I've applied for unemployment, still no check. They say, we'll send you a stimulus check. I haven't seen it. I applied for the Economic Impact Disaster Loan with the impression that I would be given a $10,000 advance that would be forgiven. At the last minute, the conditions of that loan have changed. Now it's only $1,000 per employee is being awarded to all small businesses. I'm a one-woman show. Therefore, I was only awarded $1,000. I needed that $10,000, as it is 1 month's salary. Thank God Solar Salon Studios is giving us grace on our rent. I do not have $410 a week to pay salon rent without any income coming in. I have many industry colleagues that aren't so lucky. The luxury car my non-essential business has afforded me to drive, I can't afford to keep putting payments on the back end of my loan. I need to pay it off sooner rather than later. I have residual personal and business expenses that have not stopped. I already practice sanitation and infection control in my salon. This isn't new to my industry. It's new to you and everybody else. We've been sanitizing and disinfecting our workspace since we were all in beauty school. After all, it's 25% of the continuing education requirements we must meet every 2 years when we go to renew our license. I've had EPA grade disinfectant, masks, gloves, and sanitizer at and on my station before the pandemic. I am a single mother doing the best that I can to provide a comfortable lifestyle for my son, and the government seems to have its foot on my neck. This is America. I am free. I have rights. You mean to tell me it is safer for someone to go to a movie theater than to come to my private salon in a one-on-one setting while practicing sanitation and infection control? My industry is hurting, we are bleeding, and we are not being rendered aid, and it is not right. Do you understand how much money barbers, stylists, lash artists, estheticians, licensed massage therapists are paying in tax dollars in your precinct alone? I do, because my 2019 tax bill was a little over $7,900. We feel helpless. You guys are holding people's livelihoods in limbo, and it is not right. Nobody is listening, and it seems like nobody cares. But we're going to show you how much we care in November. To my fellow industry professionals, be encouraged. I understand your plight. I feel your pain. Stay strong. We will get through this, and thank you for your time.
Thank you, Kay.
Thank you.
Thank you, Ms. Wade.
I would say that the governor's new order basically was very specific about not being able to open up salons, barbershops, gymnasiums, bars. The hope is that maybe within a week after the 1st or 2 weeks was what was mentioned, which would put it at around the 15th. And hopefully at that point in time, he'll come out with a new order at that point.
Well, and then I'd just like to add, since
Go
she
ahead.
had directed her comments specifically to me, I appreciate you, Ms. Wade, for calling in. And our staff will be sure to follow up with you regarding some of the benefits that you are already working on and see if we can assist further with those. And then if not on those, to see if other ways that we can help to offset some of the needs that you have. So we will be in touch. Thank you.
Next is Rachel Barton.
Hello.
Hi, Rachel. This is Judge Whitley, and you had requested an opportunity to speak at our court meeting this morning. So at this time, I'm going to ask you to state your name and address, and then you will have 3 minutes for any comments you wish to make.
Okay, thank you, Judge Whitley. My name is Rachel Barton, and I'm in Arlington, Texas, 76015. First, I would just like to thank you all for your time, and I hope you listen to this with an open mind. I appreciate Governor Abbott's efforts to open businesses in the state of Texas, and I'm sorry, I'm getting some feedback. Give me 1 sec. Okay. I feel like we should open all businesses, salons, and playgrounds, not through a phased approach, but we should open them 100% without restrictions of social distancing, face mask, or fines and jail time as a precaution for not doing those. What the governor said puts the salon opening date 3 weeks from when he made that announcement. And these people don't have 3 weeks to wait. The stats speak for themselves. Let the business owners, consumers, and parents decide for themselves what they feel is safe for them without government oversight, because the risk of getting sick is going to vary from person to person. Notice I said the risk of getting sick, not dying. Those stats were not discussed by the health department, and those are the ones that should be looked at in regards to social distancing. The goal was never to prevent people from getting sick. We started this to slow the spread and prevent our hospitals from being overrun, and that has been achieved. As of this morning, 89% of beds and 70% of ventilators are available. 58 deaths out of 2 million population in Tarrant County comes out to be a risk of 0.0028%. We are causing severe economic and emotional hardship for a virus that has essentially a 0% death rate. Yes, some have died, but if you take the 60% of those out who are over age 65, it will be even lower, and they don't even publish comorbidity here in Texas. In other states they do, and I've looked at them, and almost 100% of cases have serious comorbidities. So how can you justify only operating at even a 25% capacity with these figures?
If people are afraid or at greater risk, they can wear a mask or stay home. They have that right. Everyone's protecting themselves with the mask or by staying home, not one another. Healthcare workers included. You don't wear a mask to protect the vulnerable or to, quote, save lives, as people are quoting on TV, the news, commercials, whatever. You wear them to protect yourself, simply because, especially for healthcare workers, they're at a greater risk. They're dealing with contaminated droplets, which is how the virus is spread. The general public, including business owners, can do the same if they choose. But furthermore, it's not only illogical to require businesses to remain closed at any percentage, but it's unconstitutional. It's a matter of opinion and speculation that the governor's executive order was enacted with and does encroach on our constitutional rights in the United States of America that you as the Commissioner's Court have a duty to uphold. So I do urge you to open Tarrant County now and without restriction, and to set the example for other counties, not only in Texas, but across the U.S., for we all are all one nation under God. Those are my main points of this statement. With the rest of my time, I'd like to give further rationale.
Well, your 3 minutes are up. Stacy, your 3 minutes are already up.
Okay. Well, I guess I won't get to go into the playground.
I said Stacy, but I meant Rachel. Let me just. Okay, so your time is up. What I would just simply say is, with the governor's order, it was pretty well taken out of our hands in order to be able to do anything that would lessen the restrictions that he still has in place, or allow us to modify that in any way. So really, at this point in time, it's taken from our hands as to what we can do, and it is now totally in the hands of the governor and the state as to opening or closing, and when we open or close businesses, or how we open or close businesses. So I appreciate your comments. And
if I may say one last thing, it's my understanding that if his order is proven unconstitutional, which they are proving in other counties, that could maybe take the place of his. Is that incorrect?
Well, his orders are basically the law right now, and I have not heard any other counties that have. I mean, he just did this yesterday, and I have heard no county at this point in time that where his orders have been found unconstitutional. So with that, your time is well past, and so I'm going to thank you for your comments, and we're going to move forward. Thank you. Next is Stacy Coleman. Stacy does not wish to speak, and so I will read what she has said. I am wondering how the decision came to be about lifting the stay-at-home order so soon. How did the mayor, governor, or whomever it may be decide to lift it so soon, especially since cases are still continuing to come in? This could definitely take us back and prevent further progress or stunt the progress started to be made. I feel it could have been a little bit longer, especially since people's lives are at stake. I understand businesses needs to get back to business, but if you are not around to run the business, it really defeats the purpose. People need to be healthy to actually live and run their businesses and households or whatever else. I just think this could prevent further progress and get us back to where we were or even worse. The next comment, again, does not wish to speak, is Brian Jennings. His comment is, I would like to request the Commissioner's Court adopt the governor's order as is and do not attempt to place any more restrictive measures on Tarrant County residents. Secondly, I ask that the Commissioner's Court request Tarrant County Public Health place a notation on their COVID-19 metrics that the recovered numbers are not complete and are not representative of actual number of Tarrant County cases that have recovered. Next is Janine Nichols. Her comment is Tarrant County needs to open everything 100%. People who don't want to go out don't have to go out. People have a constitutional right to earn their living including barbers and cosmetologists. By far, all of the businesses under discussion, they are the most knowledged and sanitized. If a dentist can safely work on my mouth, then surely someone can safely cut my hair. Next is Brian Jennings sneaking in here twice. Brian Jennings wishes to speak on another item, but it's basically on item A4, approval of consulting services related to COVID-19 program. He says, please table the discussion until public can review a detailed plan of what services Guidehouse is offering. That will come up in just a few minutes. And that is all the public comments for today. So with that, Mr. Manius, I guess we are on item 3, and there's 2 action items, I believe, in that group. And before we do that, we're going to take a little 10-15 minute break. I know I've got them on the line, so I've always got a quorum on the line here. Y'all will never know. Yeah, but you won't know till I call a vote.
I need to think about how I'm going to answer that.
Mr. Manius, you're on.
Thank you, Your Honor. Before we get to, let me just ask a question. Mr. Kyle, are you on the phone? Terry?
I'm here now.
Very good.
Yes, I'm here.
Oh.
Very good. So we're now going to go back to item number 1, which is the annual independent financial audit for Tarrant County for the fiscal year ended September 30th, 2019. I'm going to ask Mr. Kyle to address the court at this time.
Hello, this is Terry Kyle with Deloitte & Touche. I apologize for the issue earlier. It's now been corrected. I'm pleased to be able to meet with you, albeit virtually, to discuss the audit of the financial statements for the county for the year ended September 30, 2019. Our audit was conducted in accordance with generally accepted audit standards and government audit standards, which are also required because we are in the process now of conducting the single audit, the audit of the compliance for the grants. We received full cooperation from management. We received all the documents we needed. We appreciated their support. The end of our audit, in fact, was done virtually, which was quite a challenge, but we were able to complete everything we needed to do, receive all the documents we needed to receive, and complete our audit appropriately. Our opinion on the financial statements is an unmodified or clean opinion, if you will, meaning we do believe the financials are presented fairly in accordance with generally accepted accounting principles. We're able to remain independent throughout our audit and again, like I mentioned earlier, receive full cooperation from management in the conduct of our audit. Be happy to answer any questions or comments that you might have.
Terry, this is Judge Whitley. You know the drill. On page,
yes, I do.
On page 52 of the report, it basically says that Local Government Code Section 157 assigns the authority to establish and amend benefit provisions to the Commissioner's Court. The county is under no legal obligation to pay these premiums. The decision to provide these benefits is made by the Commissioner's Court on a year-to-year basis. I guess I could argue that it's a week-to-week basis, but what I would say is GASB requires us to put on our financial statements a liability, which I do not believe that we have, and because a liability is defined as something that contractually we're obligated to pay, and we are under no obligation to make those payments. But in order for us to get that unmodified opinion that you just referred to, GASB requires that we put a liability on that financial statement. So even though these are our financial statements, they are not that liability is not one that I consider to be a true liability because of the fact that we have that ability, and we are not contractually required to provide those benefits on anything more than a week-to-week basis. So that's the statement I want to make to you, and then I guess I want to thank you and your team for the work, and I especially want to thank our audit department and the work that they put forth to bring this to this point. I know that they work extremely hard to get this prepared and get it completed, and obviously they had a few more obstacles in their way this year with everything else that was going on. So again, I want to thank everybody for their effort. Again, it's something that I know they're proud of, and I'm as a bean counter, I'm also very proud of the way they do this. I know a lot of entities who pay to have people complete their CAFRs, and I'm very proud of the fact that we prepare a CAFR that has very little, if any, changes as a result of the audit that we just completed. So with that, I will ask if any of the members of the court have any questions. Commissioner Allen? No questions?
Not right now.
Thank you.
It's very thorough.
We're requesting that the court receive and file this document.
Move to receive and file.
We have a motion second to receive and file. There being no discussion, Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Terry, thank you. I'm sorry you had to listen to all of the other, but that's what you get when your phone refuses a phone call from me.
I agree, not at all. I actually was very instructive to hear all the citizen comments, so thank you very much for the time. Hopefully I'll be meeting with you in person next time.
Hopefully you will be. Thank you very much.
So members of the court, if we can go to item number 2, this is discussion possible action concerning the various declarations of a local disaster, not only those that the Commissioner's Court has enacted, but also the Governor's 3 executive orders that he issued yesterday. I did provide each of you a copy of those 3 orders in your red folder. Also, Commissioner Brooks and Commissioner Johnson received those by email this morning. So this is just a discussion item. If the court has any comments about that, these 3 from the Governor or the executive order that Judge Whitley, you have in place at this time.
And just to kind of give the court an idea of where I am at this point in time, is the order that we currently have in place that y'all have ratified expires on April the 30th, and after discussions with our attorney as well as some preliminary discussions with the mayors yesterday on our call, it's my thoughts, at least at this point in time, to let my order expire and for it not to be renewed or clarified in any way, shape, or form. I think that if anything that we were to do would potentially bring questions that we would then end up having to try to interpret what the Governor meant versus what we were trying to do with our new order or extended order. So my thought right now, at least as we move into this area of discussion, would be to simply let the order expire and to not do anything else at this time.
You need a motion?
I don't think that requires any action whatsoever. I think that it will simply occur, and we'll be free until the declaration of emergency goes through, I believe, June 14th.
I think 14th or 15th, yes. 15th.
And so then at that point in time, I can issue any order between now and then, and at any point in time, we could end the declaration of emergency, but I don't think we're ready to do that at this point in time.
No, but so we're saying that there is nothing that we could do by way of an order, and therefore we don't need another order?
I think so. Because anything, I mean, this time the governor was pretty specific. In the past, he said, if you're not consistent, or if it's not inconsistent, if it doesn't pertain to anything I'm saying, then you can do it. But now it's to the point of where he's pretty well saying, here's the way we're going to reopen, and specifically, you cannot force everybody to wear masks. You can strongly encourage them.
Yeah, because that's not what I read or understood in my reading of the order. It's individuals are encouraged to wear appropriate face coverings, but no jurisdiction can impose a civil or criminal penalty for failure to wear one.
Okay, so how's that different than what I just said?
You said that we couldn't put it in an order.
We can't force them to wear masks.
Right, so you're saying because it's not enforceable, then there's no point in putting it in an order.
Yeah, because he strongly recommends in the order that we would, only order we could make, and I agree that we should. I mean, the only order we could make would be to simply strongly recommend that they wear a mask, but he's already done that.
Okay.
I mean,
well, this is the purpose of the discussion. I just find it hard to believe that there's nothing more that we could say or do. And if that's the case, then I just need to accept it. But this whole time, it's been mostly up to us to figure out what works for our county. And so if we are being told unequivocally that there's not anything more that you can do to protect your residents, everyone must follow the governor's order, not do anything more, then I take issue with that. I don't necessarily want to be absolved of the responsibility of doing more. If we can do more, I don't know necessarily if there's more that we can do. So.
And Leslie or Sharon, do y'all, or Chris, do y'all, either one of y'all want to make any comments with regards to that?
I think that the governor has pretty well preempted whatever authority we have to make orders concerning our community. We could leave in place the order that we've got, but to the extent that it conflicts with his order, it's null and void. I wouldn't have a problem with leaving our order in place.
The only problem that I have at that, Commissioner, is that it's then confusing, and it will generate hundreds, if not thousands, of questions that will come into our offices about what does this mean? Or it's just the previous one. Why can't hair salons open up? Well, because the governor said that hair salons couldn't open up, we think. Those are.
So then in the discussions that have taken place so far, and thank you, Leslie, for coming to the mic, we've looked at our current order, we've looked at the governor's newest orders, and we haven't identified any gaps or opportunities to where we could do more to ensure that we are caring for the health and safety of our community while also ensuring that we're doing the most that we can for our economic stability.
We have reviewed those, and I guess technically you could put something in an order, but it would have no effect. And so it is confusing because it is, you are saying you must do something, but yet there is no penalty at all there is no enforcement mechanism. And the governor did take that beyond the county's control when he did that, and specifically said, because Harris County and Dallas County have required masks, he specifically said in the press conference that they can't require masks because he is only urging them. You cannot mandate it. And unfortunately, that is the predicament that we are in as well. With regards to our order, it currently says that certain things cannot be opened, that his new order says can be opened, so there are conflicts there. that by allowing ours to expire, just the executive order, not the declaration of disaster, by allowing that to expire, it does eliminate any confusion because we cannot conflict with his order.
Okay. Well, I just have to ask the question and make sure I understand the answer and make sure when I'm talking to my constituents that I know that we've done everything that we can do. If not, then we've failed them. And I know none of us are okay with that, but if we've exhausted all of our options, then this is what we're left with.
If we can come up with a way to get creative, we are going to put our heads together and think of it. But at this point in time, it doesn't appear that we can conflict with the order. We can't expand certain services.
Sure.
His order says that we can't. And so that's where we are right now.
Okay. Thank you, Leslie. Okay.
Commissioner, I mean, I would say the same. I mean, obviously I had the opportunity to have this conversation with the DA afterwards. So that was the big question.
Sure.
We discussed and we went back and forth and basically came to the conclusion. And same thing in some discussions on that 4 o'clock call yesterday and calls with Betsy and with Jeff was that, you know, there might be a lot that we would want to do, but for all intents and purposes, the governor was pretty specific this time as opposed to being maybe a little open for interpretation in the previous orders. And so that's kind of where we got to the point to where we said we're probably better off to, if somebody has a question, we can simply say the governor's order is the only one that's in place right now. You need to direct those calls to the governor's office to get those answers from that standpoint. Mr. Mayes?
So are we ready to move to item number 3? This is the item that I said we will have 2 action items as relates to that. I believe we're going to take up one now and then possibly the second one later. So what we would like to do, let's talk about this just a minute. We've been working with UNT Health Science Center to set up testing sites across the county, and you've heard the judge and others talk about our strategy on moving forward on this. One of the things that we looked at staff level, excuse me if I have to sneeze, is how we're going to run those sites. And UNT Health Science Center is currently running one that is in the city of Fort Worth, and we've been working with Dr. Williams on this, and we believe it's to our benefit to allow UNT Health Science to run various testing locations for us. So what this does, this is an interlocal agreement between Tarrant County and the Health Science Center. What it basically says is that we're authorizing UNT to run these centers and that we will pay them a fee per individual that is tested. We're running one site now in Fort Worth, and I believe, Judge, we talked about the fact of maybe opening 3 or 4 additional sites. This way we can actually hit the ground as soon as we find a location and get enough testing reagents to move forward with it. The fee that we are looking at is $16.39 per test, and it also includes the insurance companies will be billed, and whatever reimbursement is not received, we would do the fund or the gap funding for that also. So we're asking you today to approve this agreement between UNT Health Science Center and Tarrant County as it relates to COVID testing.
Will you repeat
So
that
this,
about? Oh, go ahead, Commissioner Brooks.
This testing will be without cost to our citizens.
So what we would do, there would be a cost, Commissioner, as relates to each individual that we would pay UNT initially, which is the $16.39, and then if there is the UNT or actually the lab companies will bill the insurance And if there's any gap cost between what the insurance pays and what they bill us, well, then that is something that we're going to come back to court and ask the court to pay that amount.
Mr. Manius.
Yes, sir.
That language is opaque. What I'm asking you is there any out-of-pocket cost to those being tested?
I didn't understand your question. The answer to that is no, there's no out-of-pocket cost.
Thank you.
Now,
but they will be billed, their insurance will be billed if they have insurance. So, saying that it's free or saying that there may not be any out-of-pocket costs, but if they have insurance, that insurance will be billed.
That's correct.
That's well and good. I asked about out-of-pocket costs, and I believe the correct answer is no, there is no out-of-pocket cost.
That's correct, Commissioner. I just misunderstood your question. I will tell you that the costs that the county incurs, we believe that the CARE Act will cover those costs. We're requesting approval of the agreement.
One more question.
Yes, sir.
What is our ability to expand testing sites? The ones that we have now do not go near far enough to providing access to all parts of the county.
So, Commissioner, let me start by saying that that when we began to look at this agreement, we were focusing on 5 sites because there are additional sites that have been set up for testing, mostly run by private physicians and hospitals. I believe we have a total of about 22 sites in the county at this time. Out of these 5, though, that we were initially attempting to coordinate and collaborate with UNT on, there's one site that is set up in Fort Worth already. The city of Arlington has set up a site that was going to be one of those sites, and they are testing now. I believe that some members of our court have been out to that location. Our intent is to set up at least 3 more, and I don't believe that the location of those sites have yet to be determined.
Are we limited to those 5?
No, sir, we're not, but that was our first go-around at it. I believe that the test site that we have set up in Fort Worth, that, and Your Honor, you may need to help me on this, we are scheduling for the first 2 days. It went live this weekend, and I believe all the court members were notified about the fact that it to go live, that they are doing 40 tests a day, I think for Monday and Tuesday, and then they're moving to 80 on Wednesday, Thursday, Friday.
It was 40 on Monday. It's supposed to be 60 today, 80 on Wednesday, Thursday, and Friday. And then next week, hopefully they will be up into the neighborhood of 150 to 200 per day. Arlington did 133 on their first day, which was Friday. Then yesterday they did 207. And we're hopeful, as Mr. Manius said, to be looking at least 3 or 4 maybe additional sites, and then hopefully in addition to that will be a site set up with the assistance of the state, with the National Guard, and again, what we want to be careful of is making sure that as we open these sites that we're continuing to get a steady supply of the reagent necessary to run the lab tests. The last thing in the world we want to do is set up a site and then not be able to get the equipment necessary to complete the lab tests.
The site in Fort Worth, is that the one in southeast Fort Worth?
Well, there's one site right now in Fort Worth in the hospital district. I think that the next 2 sites would be sites that President Williams at UNT Health Science Center is helping make the determination of where those sites will be.
Who else is weighing in on making the determinations of where the sites will be?
I know that UT Southwestern, Dr. Dr. Argenbright is also participating. I don't know we've actually located any future sites at this time. But we can engage in conversations. We will be engaging in conversations because this is going to be the Tarrant County operation, and we're going to pay for it out of our care funds.
What's required?
I stand ready to continue participating in those discussions.
Okay.
All right.
Very good.
Physically, what is required for a site?
You know, what I've seen, and Judge, you might want to chime in on this, a parking garage is a really good site to have because they can bring the cars in, they can take them through a floor or two to do all the screening and to do the swabbing.
How many parking garages do you have for these first 5 sites?
I don't know because we haven't
One.
found. Is there? I don't know what the Fort Worth side looks like.
As Mr. Manius indicated a few moments ago, we don't have a site location for the 3 additional places. Arlington went out and worked with the Parks Mall and located and got their permission to use the bottom floor of their parking garage. The site that was opened up yesterday in the medical district is not a parking garage, it is a tent. And my concern regarding doing these under tents was well-founded last night as I woke up at about 4 in the morning listening to the pitter-patter of hail on my roof. So I'm very concerned about us utilizing tents outside. So I would hope that, but if that's the only thing we got, it's the only thing we got.
Well, a tent properly put up with the water containers.
We simply need some type of an awning that protects not only the staff but the people that are getting tested. That's why a parking garage works so well.
Well, I've got quite a bit of parking area at our family clinic in Euless.
The one thing, though, they want to be very careful about putting that in a place where you might have folks decide they want to go into a facility. The goal is to keep them in their cars and not have adjacent facilities where, I need to get out and go in and use the restroom or anything along that lines, because what we don't want to do is if they are infected, if they do have COVID-19, we don't want them going into any of the buildings.
And that was somewhat of the criteria that UNT and also UT Southwestern said. They really didn't want to try to set any of these up close to or on a parking lot of a medical facility. So.
Okay.
Could I make a comment, please?
Sure.
I am completely dissatisfied with the availability of testing, especially in the district that I represent. I will not be satisfied until there are many more sites, at least a site in Southeast Fort Worth, at least a site in Stop 6, at least a site in Forest Hill, at least a site in Como, and at least a site in Benbrook.
I think you're going to be very unhappy,
We've got the
Commissioner.
money to do that, and I expect for it to happen.
The problem that we have is regardless of the amount of money we have, we've got to have reagents. And so to believe that we're going to open up 5 sites there without us opening up additional sites throughout the county, I think is unrealistic.
Well, we managed to find enough reagents to put testing sites everywhere except in the African American community. And I'm serving notice that that will not stand.
Commissioner, we have set up 2 sites. We've set up one with the assistance of Arlington, and they are the ones that was proactive in finding the labs that had the reagents. And we've set up one site in the hospital district, which I believe is in your precinct. Now, what other sites are you talking about?
The ones I just said I want.
Well, stand in line.
So while we're talking about accessibility, and I've had conversations with Vinny about this, is the online form that we're currently using and that we would continue to use for folks to make appointments or to go through the screening process for the test sites. Is the form is not currently in Vietnamese. It's in English and Spanish, and I know that we've set that expectation with Adobe, but that's very important. And then even on and I did talk with Vinny about this, but I just want to be sure to mention it again, is even the reference that other languages are available, I'd ask for that to be put in Vietnamese. And when we look at our county website, we did translate orders into Spanish and Vietnamese, but some of the other resources and other things are not yet in those languages. So as we are increasing testing capacity, we are somewhat limiting ourselves in what we're providing to our community if we don't communicate with them in a way that they need to be communicated in.
We'll try to get that corrected as soon as possible.
Thank you.
Let me just say finally that I'm prepared to stand in line, but I won't be standing in line by myself. If you want me to march an army down to Commissioner's Court to stand in line with me, I'm prepared to do that, Judge Whitley.
Commissioner, we have been working on getting the reagents, and I don't care how many people you march down here. In effect, we need to spread this out. We are Tarrant County. We are not just Fort Worth. We're not just Arlington. We're not just any one of the individual cities. We are Tarrant County. And we need to spread these test sites out throughout the county and not just in Fort Worth. And just about every one of the places you mentioned, with the exception of Everman and Forest Hills, were Fort Worth.
Forest Hill and Benbrook.
Forest Hills and Benbrook. Mr. Mangus, continue.
So we're requesting that the Commissioners Court approve the professional services agreement between Tarrant County and UNT Health Science.
Move approval.
Second.
We have a motion and a second. Is there any further discussion?
Yes, so with the, depending on how the court votes, with the approval of this agreement, the next step is what?
Well, with this, then we're going to go back to our testing site, and we're going to get that translated into Vietnamese.
Okay.
And then I'm going to go ahead and reach out to both UNT and also to UT Southwestern to start talking about where the next sites are going to be. I will make sure that I bring that directly back to the Commissioners Court for your all's joint decision.
Thank you, Judah.
Okay, we'll now vote. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously.
Okay, so if we can go to item number, I'll tell you what, if we could, let's go to item number 5 and 6 before we talk about the professional services agreement, because 5 and 6 both deal with, one deals with UT Southwestern and one deals with UNT, and I believe that those should move fairly quickly. We can go to item number 5. So let me talk about both 5 and 6 together. We're in the process of making sure that we can share data and have meaningful data that we share with both UT Southwestern and also UNT Health Science Center as it relates to COVID. And so what we're going to be asking you to do on both 5 and 6 is to approve a memorandum of understanding, one with UT Southwestern and the other one with UNT, for the sharing of data and all of the different safeguards that we have built in so that the data can stay, so it doesn't indicate a particular individual, but we need to make sure that we get as good a data as we possibly can, as much data as we possibly can, to better analyze the movement of this virus through our community. So we can go to item number 5. We're requesting that the Commissioners Court approve a memorandum of understanding between the county and UT Southwestern on behalf of the Public Health Department as it relates to COVID-ID, item COVID-19.
Move for approval.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously.
Okay, and on item number 6, this is basically the same agreement except it's between Tarrant County and UNT Health Science Center. We're requesting approval.
I make the motion to approve.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson? Commissioner and Judge Whitley votes yes. Motion passes unanimously.
And then we're going to move to one more before we get into this, which is item number 7. We're requesting that the Commissioners Court approve Amendment 1 to the contract between the Public Health Department and the State Health Services. This deals with additional funds that will be that have been made available to the county as it relates to COVID-19.
Move for approval.
Second.
We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously.
Okay, if we could now go to item number 4, and are we going to get someone from Guidehouse on the line? Let me lay this out as we try to get them. One of the things that we've been saying over the last couple of weeks as it relates to COVID-19 is that the county needs to become well organized on how we move forward on decisions on spending the money that we've currently received from the federal government. We have looked at different entities that have participated in situations very much like this, and we are going to recommend today that the Commissioners Court enter into a contract.
Please enter your access code followed by the pound or hash sign.
Sorry about that, GK.
That's fine, Judge.
It's been interesting because the call that we just had, O'Brien was on.
Hello. Good morning.
Hello.
Morning. This is Tarrant County, Judge Whitley, and I believe we're to this point on the agenda. Mr. Manius, our county administrator, is making a few comments, and then we may have some questions for y'all at that time.
So
that's fine. Thank you.
Go ahead, Mr. Manius.
Did you ask who the gentleman is online?
Yeah, could we ask y'all to identify who's online?
Sure, I'll start. It's Chris McCon, Guidehouse.
Chris.
And I've got two others with me from the Guidehouse side, Todd and Gaurav. I'll let them introduce themselves.
Todd Hoffman, partner, Guidehouse.
Gaurav Menon, partner of Guidehouse.
Okay. Todd, Gaurav, Chris, thank y'all very much for being available. Now, Mr. Manius is going to make a few comments.
So what we have looked at various companies that might be able to assist us. Let me tell you what this company is going to do and what it's not going to do. First of all, it's going to help augment staff and help us develop the plans that we need and to move forward with determining how funds should be expended. That includes doing analysis of the needs of the community. It also is a combination of working with the county auditor's office and the budget department to ensure that our response is a coordinated response. that we, and this is very important, that we define all available revenue sources, not just the CARE Act revenue sources that we can possibly use to bring activities and solutions into Tarrant County dealing with COVID. It's also going to help us in the auditor's office and to make sure that our expenditures are legitimate expenditures and that they qualify for reimbursement, and that we also have a compliance element as it relates to that. This is what it doesn't do. It does not make the decisions for the Commissioner's Court as to how the money is to be spent or allocated for expense. It's going to help guide us through that planning process, and it's a very quick planning process, so that we can bring recommendations to the Commissioner's Court, that you can have conversations with this company and obviously with our staff, so that we can make those decisions. Guidehouse itself is a company that has expertise in this area. Just to name a few, in Harris County, it is the lead agency that is handling the Hurricane Harvey expenditures for Harris County. Harris County is also engaged Guidehouse to perform the COVID services that we're requesting here. They're also involved, I believe, in the state of Massachusetts and with a bunch of other jurisdictions. This contract is a 90-day contract, so it's a fast-moving contract, and it doesn't take us all the way to the end, but it jumpstarts all the activities that we need to perform in order to move forward. We have a very short window as far as determining where the monies need to be expended, and then the fact that the monies have to be expended. You might remember that the CARE Act is one that says all funds need to be expended by December 30th. The federal government, the Treasury, has come out and has made it very clear that any monies that we do not spend, they intend to sweep back into the federal Treasury. So this contract is a 90-day contract. It is $250,000 in professional fees plus $10,000, an amount not to exceed $10,000 for travel and miscellaneous expenses. This is something we do in most of our contracts. We believe that if you approve this contract today, then Guidehouse is going to have people on site by the end of this week.
So, and with that 200 and potential up to $260,000, where in the budget does that come from?
This will be an expenditure that will be charged to the CARE Act.
So, gentlemen, Chris, any comments that you would like to make right now about the services and how you're seeing those roll out in Tarrant County?
Yes, and I'll make the comments and I'll pass it to my colleagues. I think we have sort of reserved a portion of our team to be focused where we are at home, which, you're going to be getting delivery from Guidehouse, Texas, and we've got multiple offices in the state and can put boots on the ground, of course, virtually, as was stated this week, and then, be there in person with you as warranted, and that's fairly easy for us. This is a lot of strategy and advisory, and some of it's going to, cause some discomfort or thinking outside of the box. It's my understanding that you don't hire strategy and advisory consultants regularly, so some of this is going to be new territory. But we, as Malcolm Baldridge Quality Award-winning consultants and former PricewaterhouseCoopers public sector, are going to be with you on this, and it's something that is in our wheelhouse and that we do regularly. So, we've tried to structure this so that we don't put you in harm's way from a competitive procurement position, but also walk that line to where you get things that you need to get now that can't wait. And I think we've got a good balance of scope and a 90-day plan, and then a potential future longer-term engagement mapped out in the document we sent over. And Todd and Grob, I don't know if you want to add anything to that.
I think, Chris, you summarized that well. Why don't we just see if there's any detailed questions? We're happy to answer.
And I would like to say one more thing, Your Honor. We have been working not only with the auditor's office budget, but also with purchasing. And so we've worked in a coordinated manner to get us to this point.
And I would add that I had an opportunity to talk with Judge Hidalgo in Harris County, and she was very complimentary of Guidehouse and the results they've helped them to accomplish within Harris County. Any other questions about the services or at this point in time?
I do. This is on page 2 of the, and it's regarding the scope of work, particularly economic modeling, revitalization, plan development. Can you speak to like a couple or one example of how you've worked with the stakeholder groups that you referenced to, I guess, get an understanding of how certain segments are disproportionately impacted?
Did y'all hear that question?
Yes,
we did.
You want to take a first stab?
Sure, I'm happy to. So to just give you an example of how we've done this before, obviously economic development is not done by the city government or the county government. It's typically done with teaming partners outside, community organizations and others, and the business organizations outside of the government that actually take the funds that are available from the federal government and the assistance from the county or the city government to actually process this. We did send over an example of a capital plan that we created for the city of Joplin that was hit by a tornado back in 2011. But what we did is we had a focus group where we understood the needs of the city in that particular instance. We talked to the small business owners, we talked to Main Street of Joplin, we talked to the Chamber of Commerce, and we identified what it is that they need from an economic development to kind of spur the economy on. And then what we did was we took those needs and matched them to any kind of economic development grants that are available so that we can, through the city government, provide the assistance, the technical assistance and the support to these business owners and small business owners and community organizations so they can carry out their economic revitalization plan through the city and through the federal funds that are being received. Obviously, as you can understand, private entities and private not-for-profit entities are really not very familiar with the burdensome rules and requirements from the federal government when it comes to the spend of their money. And so that's where we were able to provide that assistance to the community in Joplin. And the good thing is the city of Joplin has been able to spend $158 million that they received after the tornado. And we've had several audits with no audit findings. And in fact, the city was cited for 3 exemplary practices. One was for developing the comprehensive strategy. 2 was for creating an integrated master schedule so that they can complete the projects on time. And 3 is for their compliance efforts. And so that is the kind of work that we want to bring to Tarrant County and to the partners that are going to be working with the county in executing the task at hand.
Very good. Thank you.
So let me be very clear about that, though. Phase 3, which is the socioeconomic revitalization strategy, is not part of this initial contract. It's all of Phase 1 and part of Phase 2. And if we decide to go forward with this company or a new company, they talked about doing an RFP. That the 90 days would give purchasing the opportunity to go out on an RFP for these type of services also. Okay. But it's not included in this initial 90-day exercise at $250,000.
Understood. Thank you.
If there are no other questions, Your Honor, we're requesting that the Commissioners Court approve a contract between Tarrant County and Guidehouse as it relates to the contract that's in your folder.
I think there was there a motion?
We do not have a motion at this time, I don't think, do we?
Move for approval.
Second. We have a motion and a second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously.
Thank you, Your Honor.
Thank you, Mr. Manius. Moving right along, Ms. Glenn.
Oh, actually, can we go back? I had a question about our PPE efforts. I know obviously that there's a team of folks that have been working to increase that access, but can you give an update on that?
So let's talk a little bit about PPE. The county ordered 1.5 million surgical masks, and we believe that we are going to get at least 1 million of those possibly by the end of this week. And Mr. Beecham thinks it may be a little bit earlier than the end of this week, but we're going to have those pretty much available then. Then our first goal is to supply county government with the type of masks that we need. Our law enforcement, our jailers, our public health people, all of those that need masks. We're also making that distribution to the departments also. You might have seen some of the county employees already wearing the surgical masks. Those have been provided by the county. We're using emergency management to also check with our partners, our local governments, some nonprofits, but mainly local governments, to make sure that they have adequate PPE. They're pushing up STAR requests, which are State of Texas Assistance Requests. That's what STAR stands for. And we're tracking those to make sure that we have adequate supplies there. One of the things that we have also done, and Kristen in our offices is running point on this, we're working with United Way because we have two foundations. And Kristen,
Rainwater and Morris.
And what was the last one?
Morris,
I'm sorry. It's been a long day. Rainwater and Morris, who have volunteered to provide PPEs to nonprofits. And so we're capturing some of that data and pushing it to United Way, but United Way is stepping up, and we're encouraging the nonprofits to go directly to United Way, and they'll handle the administrative piece of that. And but before, if some of those need some type of mask or anything like that, it's our intent to bring agreements to the court for us to distribute those masks to those nonprofits. We've asked the district attorney's office to put together kind of a boilerplate agreement so that we can move fairly quickly on our Tuesday agendas to get those approved. So that's where we're at this time. I would like to say that we had the face shields. Harmony Schools that you all have supported. They have provided 100 face shields to the county at no charge, and we've disseminated those or distributed those. And I believe that they intend to have asked if we need any more. And we've asked public health to determine if those masks are high quality masks, in other words, usable. And public health states that they're just fine. So we're going to ask them to make some more. The students with their 3D printers are making those masks. So I think we're moving pretty well, or pretty well forward, pretty good forward to go ahead and do the PPE issue. The one thing you're going to hear, Commissioner, is that when we say we have adequate PPE, we're not talking about 30 or 45 days out. We're talking probably a week to 2 weeks out. So every time we can grab PPEs, we're doing that, and it's going to be a continuous effort until we get past this issue.
Very good. Thank you.
Ms. Glenn, receive and file the personnel agenda.
Move to receive and file the personnel agenda.
Second. We have a motion second to receive and file the personnel agenda. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously. Jack?
We have 4 items for consideration this morning. Our first item is a bid award recommendation for RFP 2020-075, annual contract for audiovisual systems maintenance and repair for information technology. Recommendation will be to award per the terms of the contract, awarding to the primary, secondary vendors as shown in your court communique.
Move for approval.
Second.
We have motion second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously.
Item number 2, also a bid award recommendation for bid 2020-087. This is our contract for transportation of human remains for the medical examiner's office. Our recommendation would be to award a per enterprise basis, selecting as our primary vendor Fort Worth Funerals and Cremations, secondary vendor AccuCare Mortuary Service.
Move approval.
Second.
We have a motion to second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes. Motion passes unanimously.
Item number 3, also a bid award recommendation for bid 2020-094, bid for electronic monitoring for CSCD. Recommendation would be to award on per the terms of contract, awarding to Recovery Monitoring Solutions Corporation, doing business as Recovery Healthcare Corporation.
Move for approval.
Second.
We have a motion to second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes. Motion passes unanimously.
Last item, number 4, item in regards to request for qualifications 2020-051, RFQ for professional architectural engineering services for the 350 West Belknap building renovation project. Recommendation be to award per the terms of contract. We're seeking approval to conduct negotiations first with GSB as architects, the highest scored vendor, Freeze and Nichols, and Bennett Vendor Partners if necessary.
Move for approval.
Move approval.
Second.
We have a motion to second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously. Thank you, Jack. I saw that ugly mask you were wearing.
I have a sticker for your new truck, by the way.
Yeah.
Prefer windshield or
better
bumper?
not be no hog show up on
Bumper or
my...
windshield, your choice.
Yeah.
She wants plastic.
Commissioner Fickus, you got a...
I do. I have an interlocal with the city of Haslett, and I move for approval.
Second.
A motion is second. Any discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
And Judge Whitley votes yes. Motion passes unanimously. Are there any appointments?
Yes. I have an appointment. Near Southside Inc. has requested an appointee to their board of directors. Kristen Camarino, mobility coordinator in the administrator's office, has been involved with Near Southside Inc. in some capacity for 7 years. She resides in the Near Southside TIP district area and served on their board in her previous capacity as director of a local nonprofit based in the Near South Side. I nominate Kristen Camarino as Tarrant County representative on the Near South Side Inc. Board of Directors.
Second. Oh, JD.
We have a motion to second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes. Motion passes unanimously. You have before you the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
We have a motion to second. Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
Yes.
Commissioner Johnson?
Yes.
Judge Whitley votes yes. Motion passes unanimously. We've already had the briefing items. At this time, we'll recess our open meeting to proceed to close to discuss items exempted under Section 551.071, 072, 074, 076, and 087 of the Texas Government Code. Let's go on.
Did we do that last week?
Okay, just stay on the line here because we're going to get this thing working. Okay, Commissioner Brooks, are you on the line? How's that working for you? Okay, what's Commissioner Brooks' telephone number?
99407.
No, it's 682 something. He's changed the number.
994.
No, it's 682.
When you called them on, and there was the 994 number.
Give me the number,
40750.
I got a better idea. Just a second. Hold on, JD.
Yes.
Yes, sir.
No, he's fine.
Okay, hold on just a second. JD, are you on? Okay, I got JD and Roy. Okay, now we're going to go. Okay, we're back open. Having returned from closed session, we'll now address the following matters. Ms. Glenn.
Good afternoon.
Speak up.
So we have some action that we're asking the court to take. The court did take action on April the 14th, a couple of weeks ago regarding expanded family medical leave, specifically with regard to the 10 weeks of expanded family medical leave. The court's decision on the 14th was that the county would pay 2/3 of the employee's regular salary, and then employees could actually supplement, if they elected to, the 2/3 with 1/3 using their own accrued. Okay, do I start over?
No.
No, keep going.
So then employees could use their own accrued time to supplement the 2/3 salary that the county provided. And so today we want to have the court revisit that issue.
So it's my understanding that the federal government has now reversed their position.
Yes.
And said that we could do a couple of things. One, we can pay them the 2/3, or we could require them, in order for them to get 100%, we could require them to use their paid time off to the full extent to be able to get up to 100%.
Yes, sir. What we were provided with probably a couple days after the meeting on the 14th was what's called guidance from the Department of Labor, which is not unusual when you have any act that's passed into law. And so the guidance, Judge, as you just summarized, would provide then the county with the option of having employees actually use their own accrued time. Again, we're talking about the 10 weeks under expanded FML. So the county does now have the ability to require employees to use their paid time first, and then of course would supplement with 2/3 any time that would not cover the 10 weeks. And so the proposal that we have for the court would read as follows, or it would be summarized as follows: based upon DOL guidance, we are proposing that for the 10 weeks of expanded family medical leave, that employees would have could select one of two options. First option, employees could receive payment of 2/3 of their regular pay, not to exceed $200 per day or $10,000 in the aggregate, or employees could utilize their own personal leave balances, and that would be equivalent to 100% of their salary.
So moved.
Second.
We have a motion and a second. Any discussion?
Well, just a little bit. So you have moved to change to let the employees but basically that is the only option now.
They have two options.
They still have two options?
They have two options. They can either receive 2/3 up to a maximum of $200 per day, or they can use paid time. They can use their bucket time, whatever the bucket is. They can use the bucket time and receive 100%, but it's not. It's going to be 100%. It's not going to be any of the 2/3. It'll just be 100% in order to be able to.
That's correct.
So you're either going to get paid 2/3 up to $200 a day, or you're going to take paid time off, or whatever the bucket is that you pull from.
I think I voted against this.
I think you probably did.
So would you include in your motion and to rescind that court order that was approved April 14th dealing with this matter, and I'll give the clerks that court order number?
Yes, I'll move to rescind that because I did vote for that the first time.
Yes, you did.
I'll second.
Got a motion and a second. He also voted for it that day. Any other discussion? Commissioner Brooks?
Yes.
Commissioner Allen?
Yes.
Commissioner Fickus?
No.
Commissioner? Okay, you voted against it the last time because you
I don't
wanted
like it
this.
any better. We're still giving.
Commissioner Johnson?
Yes.
And the Judge Whitley votes yes, so the motion passes 4-1.
That's all we have at this time.
With there being no further business, we stand adjourned.